How do I know the difference between an attending and a resident when they come in the room for rounds? Because the attending asked me a lot of questions about my child, about what they're like at rest, during sleep, when they're awake, when they're eating, when they're playing. They want to know everything. They want to know what we've experienced, what we've seen, and they want to know what other doctors have done. A resident may ask 1 or 2 questions and then wants to tell you what they know and rush to telling you what they think it is. And it's generally something that's very basic. For example, you have a child with respiratory issues and they want to tell you very, very quickly after meeting you and your child that babies hold their breath, that babies do weird things, that babies have weird breathing patterns, that the DSAT caught on video or happening right in front of them can't possibly be happening because, quote, it's not a perfect wave. Understand the wave. Look at what's happening clinically. An attending looks at what's happening clinically before they're looking at the monitor. A resident looks at the monitor, then looks at what's happening clinically, and then tells the parent not to watch the monitor or that the monitor is wrong. An attending already knows they're smart. An attending already knows what they know and doesn't feel the need to prove it. They're not in competition with the parents. A resident comes in the room and is immediately in competition with the parents. Why? Because they're in competition with each other to prove they're the smartest resident in the room, the smartest in their class. They are not supposed to be in competition with the parents, and yet they are. Constantly trying to prove what they know and how smart they are and how they know more than the parent. An attending will come in and ask you, has your child been on a ventilator? Have they been on a CPAP, BiPAP? Have they been on oxygen, room air? A resident comes in and says, there's a machine that can help your child breathe, and then tries to start explaining it to you. See, the attending wants to get to know the parent. The attending trusts the parent, knowing that a parent, especially a parent of a medically complex child, knows the ins and outs of their child. They know every breath, every breathing pattern, and what it means. They can tell you the color of their skin. They can tell you the color of their eyes. Are they red? They can tell you how they move, how they blink, how they sound, how they eat. They can tell you everything. They can explain it to you. They can give it to you in detail and tell you exactly what's happening with their child. A resident comes in and doesn't want to spend the time getting to know the child and the parent. They don't trust the parent because the parent's not the MD, right? The parent hasn't gone through medical training like you have, right? But what you have gone through as a parent of a medically complex child is the training for your child. A resident has gone through training and has learned in a book, which is very important and very good. They have seen lots and lots of patients for a few minutes at a time. They've seen your child for a few minutes at a time. Our parent lives with the child 24/7. You are their primary caregiver. You are the one who's up all night taking care of them, giving meds, changing tubing or trachs or putting back NGs that get pulled out, feeding them around the clock, writing down everything that's happening, taking data. You're looking at every single detail. You're tracking everything. And so when a resident comes in the room, instead of using that to their advantage, they almost become defensive. An attending comes in the room and knows that information about a parent and uses it to be able to better take care of the child and the family. They use that information to come up with a greater, faster, better, stronger diagnosis and to better support the family, to have a better bedside manner. So the difference between a resident and an attending is the attending does not need to be the smartest person in the room. They don't need to prove they are the smartest person in the room. They take the time to get to know the child and the parent, and they use the parent as part of their team. A resident comes in and is in competition and trying to prove themselves. Don't need to do that. So that's the difference between an attending and a resident. Just a few things to learn.